I'm Dr. Jacob Johnson. I'm a practicing otolaryngologist at SH Medical. I'm also the president of SH Medical, and I spend most of my time taking care of patients in the clinic and operating room, and a smaller portion of my time managing SH Medical and working on some research projects for new technologies that are emerging in our field. So people want to know how my journey began from my life in Kerala, India, to now being at this amazing medical practice in San Francisco. I was born in South India, in Kerala, which is the southern tip of India. It's a thin coastal state, um, and it's primarily known for its spice trade and its seafood, and also for its maternal culture and its tolerance of different religions and its really high literacy rate. So Kerala has Hindus and Muslims and Christians and Jews and Zoroastrians, and was the hub of the pepper and other spice trade. And it was a place where there's a lot of cultural interaction with people from other um, communities around the world. And at the same time, it was isolated from all the wars and issues in northern India, where there was all this conflict, from China and Italy and Afghanistan and northern India. Uh, all of the trade and land trade and wars, South India was spared. And there was a lot of focus on education and farming and religion. And there wasn't a lot of technical trade there. So a lot of the people there would go off to Africa or the Middle East or Russia or Europe or America to work. And then they would often come back home and be home in Kerala afterwards. My parents did well. They were in the middle class. My mom was a chemist and an English teacher. My dad was an engineer, and we had a really nice life in India. I really enjoyed being with my grandparents. I had lots of cousins, uncles and aunts. But my parents were adventurers, like a lot of people in Kerala. They wanted to do something different, and so they decided to come to the United States to see what it would be like to try something new. I don't think they thought they would come here and stay here. I think they thought this is something to do because my dad's brothers had gone to Africa, had taught English in Nigeria, and then had come back, for example. Um, and my mom's two brothers were in the US, and one was in Houston and one was in Washington State. And so they chose to come to Washington State with their younger brother. And for me, I didn't know a lot about the United States as an 8, 9-year-old. What I knew was that there was Neil Armstrong went to the moon. I knew about the land of milk and honey. I knew about the Statue of Liberty. That was about it. I also a little bit knew about Lewis and Clark and Sacagawea. So some of those like kind of big stories in American history that you would imagine like an 8-year-old learning in school in India. Um, I was fortunate to go to an English-based school in India. English is a national language with Hindi, so kids are taught both English and Hindi. So in coming to the United States, language was not a big challenge, like with other immigrants. Also, we were born into a Christian family in India, so the religion also wasn't that challenging. And so my name, Jacob Johnson, comes from the fact for many generations we've adopted Christian names in light of our religion. And the kind of legend is that the original disciple Thomas, Doubting Thomas, if you guys know anything about Christianity, one of the Jesus' disciples, came to India, was martyred there, and started the Indian church. And then over the years, when the different colonials came, when English came and the Portuguese came and the U.S. Evangelicals came, they also started their own churches. And so there was a rich kind of Christian heritage in India, but it's still a very, very small percentage of people in India are Christians, mostly in South India, mostly in Kerala. So ironically or interestingly, when it came to Washington State, my name, my language, and my religion were kind of mainstream here. So it wasn't a big shock. My uncle, my mom's brother, was here, and Washington State was like, in my mind, like represented the land of milk and honey. I kind of fantasized like Lewis and Clark and Sacagawea and going on the Columbia and Snake River and trying to figure stuff out. So it was an amazing life for me. Um, Interestingly, at the same time, my younger brother, who's 6, 7 years younger, was having a hard time developing language. And they thought at the time it was because he was hearing both our native language from India, Malayalam, and English. So maybe that's why he wasn't gaining language. Um, Back then, a little bit of foreshadowing, people weren't looking at newborn screening for children for hearing loss, and they weren't thinking about hearing necessarily as an issue for communication as much as we do now. Finally, an astute person at his school said, hey, he should get a hearing test. When they got the hearing test, he had severe hearing loss in one ear. It was like profound. And then just significant or severe hearing loss in the other ear. So he was fitted with hearing aids and provided therapy, and went to like special school partly, and then regular school partly, and an incredible effort by my parents to help in that rehabilitation. Because as kids, we form our hearing and our language early in life, right? If you're deprived of that in your first few years, it's really hard to catch up. He really wasn't kind of diagnosed till he was 6 years old. So there was a lot of catching up to do. And a lot of the focus of our family from that time on was to help rehab him and get him to a place where he would have language and like his intellect could grow, because he had missed information for all those years. So that fascination of how the brain works and how data works in your brain and how do you get data into your brain and how to use it to do things, like that was something that I thought a lot about, and my family did. Seeing the rehab that my brother went through, the interaction with hearing aids, with audiologists, speech therapists, the school systems. Because, for me, it was like completely opposite. Like I was a gifted student, learning came naturally, physically gifted, like nothing was hard. So to see how hard it can be versus how easy it was, it kind of was this juxtaposition for me, and created a lot of empathy for me about, well, if you can't hear or you can't see or you can't run or you can't breathe, can't think, it's hard, right? And so this is like the spark that I think made me think a lot about science and biology and physics and like just application, exercise, um, and just a discipline of like learning and getting better and sharing that with other people. I love coaching, different things, and I worked at a racket club and like taught sports to people, taught classes. I mean, it's kind of this natural inclination that all kind of came together. My own kind of interest with this motivation with that was provided. Kind of fast forward, my brother is a dentist in Texas. He's done really well, and my parents did an amazing job getting him from a place of deficit to a place of success. And that's the same thing that I think about when it comes to medicine. Like people have, an acute injury, or they have a chronic health condition or disability that provides an opportunity then to like get them back and maybe even thrive past where their potential could be. So my studies were in mostly sciences, but also I appreciated math. So I also studied math and economics. And I really considered all kinds of fields. I considered economic fields. I considered engineering. I considered chemistry, because my parents were engineers and a chemist. I considered research, but I really wasn't really good at a lot of those things, even though I was good at school, but I really wasn't really good at the practical application of many of the things I just mentioned. So kind of in a funny way, I kind of back-ended into medicine. Medicine was like the default kind of strategy. Applied for medical school. And I'm just really fortunate that I loved being in a doctor. Like it was just one of those things where I'm glad it would have been fine as an engineer. I would have been fine as a chemist, but medicine was the right place for me. And then one of my deans was an otolaryngologist and said, hey, you should consider a surgical field. I was thinking I'd be a pediatrician or an internal medicine doctor, which are amazing fields because you take care of the whole body. You think about everything. As a pediatrician that had helped my brother. And I was fortunately not really a sick person. So I really never went to the doctor. I really didn't know much about surgery or cancer or radiation or mental health therapy. Like I didn't know about the breadth of what the different specialties were. I kind of knew my pediatrician. So I was like, well, I can be a pediatrician. But I did a rotation with my professor, my dean, who was an otolaryngologist. He did laryngology. He did surgeries on the vocal cords for speech. And I was exposed to the different aspects of otolaryngology and head and neck surgery. And it really clicked because it's what deals with the sensory systems. It manages these 12 wires off the brainstem. These 12 wires we call the cranial nerves. They do from the first one, smell, to the 12th one, moves your tongue. But in between, it does vision and taste and facial movement and expression and chewing, swallowing. It does everything, right? All the work, all the little parts are done by those 12 wires, and through intricate anatomy, through the bone of your skeleton, your skull, and your neck out to your face. Our field is the surgery, the medicine, and the therapeutics of those 12 cranial nerves and managing your senses, your respiration, your voice. And so it was perfect. I liked being able to do surgery. I liked being able to see patients in clinic. I liked the fact that we could offer therapy like my brother was given with hearing aids or balance therapy. And I liked the fact that we could take care of brand new little babies all the way to end of life. It's, most physicians don't get to do that. They're either a pediatric person or an adult person. Only a couple of fields like otolaryngology and family medicine do you get to take care of the whole breadth of life. And it really has a primary care bent to it. I'm not a pediatrician or an internal medicine doctor, but we take care of patients for their lifetime because otolaryngology issues are a lifetime of spectrum. Just like my brother, he still deals with audiologists. He still deals with hearing aids. He may at some point, if his hearing goes out, need a cochlear implant. So we take care of all generations of family members, and it's lovely in our clinic that we have the grandparents, the parents, and the kids, and you get a real relationship. So this has been my journey, and I was very fortunate to get to train at UCSF. It was an incredible place that really emphasized neuroscience and at the same time the practical aspects of otolaryngology. And that further increased my interest. The cochlear implant was partly developed here. So the whole concept of giving a sense back, it's the only sense now that if we lose that we can give back with technology and the research that went behind it. And when I finished my training, I joined a practice that now in this year of 2025 has been here for 85 years. So that, again, that longitudinal understanding of people and community and just seeing the spectrum of life and health, I've been very fortunate. I've been at this, I started my practice in 2001 with Brian and David Schindler, and it's now transitioned to, we have many providers and multiple specialties throughout the Bay Area, and it's just been a very special journey. When you get to practice where you trained, it's really special because you know everybody, they've seen you grow up, and you've seen other people grow up. And so that relationship in, San Francisco is a big city, but really it's a really small city. And so it's really special to be part of this group. And we have transitioned from an ENT focus, otolaryngology, to SH Medical, which is the encompassment, the ability to have this entire journey that I mentioned, where we can take care of patients, whether they need an object like a CPAP machine for sleep apnea, whether they need a surgery like having their tonsils removed, or they need therapy like balance therapy because they're falling. We have brought all those things together into one place, and our practice is thriving because it puts the patient first and really thinks and focuses like somebody did for my brother all those years ago. It's been really fortunate in my career to both be a physician but also be a teacher, an educator for students and medical students and residents, and also be able to do research on new technologies in our field. And I've also been able to learn to be an administrator for our practice, doing the management of our practice. It's been really one of those things where I've just been, the opportunity has been available, and I have taken that opportunity. And I think this is something that's really important for, it doesn't matter what your career is or what your journey is. I think I am not that old to give advice about careers, but I've been doing it now for almost 25 years. So I can say, you will get opportunity to expand, and you can choose to stay in that path of, hey, I do this and I'll continue to do this, or let me explore this other option, or add this other option. And I would just encourage you to do that, because the longevity, the passion, the excitement of a career is based on adding new things to it, and you then get better at your key focus. So I'm a much better doctor and surgeon because I teach young people and the energy they provide, because we do research and study things at a deep level and bring new technologies to the patients, and because I understand the kind of nuts and bolts of how medical practice works and medical economics. We can do so much better for our patients in terms of navigating a complicated system. Um, so I would just say it's it's kind of a simple answer. Like, if someone gives you an opportunity, take it, learn it, do it, and keep the core function. I am still 95% a doctor and a surgeon, but the icing on the cake, the 5%, is sort of what's made this journey really sweet for me. As I had mentioned in my story, I sort of back-ended into medicine. I considered a lot of other things. And so the one question people ask is, well, how'd you know? I'll tell you this story. I was really interested in economics, more the math of it than the application of it. And I was at a conference in Indiana University for economics. And we were living in Texas at the time, and we were taking a road trip as high school students. It was my senior year, to Indiana and back. And there was just something about that trip where at the conference there was so much focus on the immediate, the concepts of income generation and strategy. And I love that stuff. I really like thinking strategically. I like thinking in the moment. But it just felt a little bit, and this is not to be critical of people who do that. I think it's amazing, the people who do finances and economics. But it felt just a little bit like not the ability to give as fully as a service field like medicine. So for myself, like being a teacher or being someone who provided counseling, maybe even something in the spiritual realm, or being a physician who treated and cared for people, like that part of me kind of called on me in that trip. It was sort of like, this is really fun and exciting to be at this like economic thing, and I could have gone to like this cool school for economics afterwards. And but it didn't have that depth that I wanted of really connecting with people and caring for people. Back to another story about my brother, like I still remember his first audiologist, even though I was like, 13 years old. I remember his first speech therapist. I remember his like first grade teacher. These people changed the trajectory of his life. And so I want to do that too. I wanted to do that in a really important way. And it felt like some of the other fields that I'm really good. I'm really happy I wasn't very good at them, because when I did internships or was in a lab or try to do other things, I really wasn't trying to build things as an engineer. I wasn't very good. So the funny thing is that, that my lack of kind of success in other things led me to the success in medicine. But the core issue was that need for deep connection with humans and trying to shift the good in a daily way. Yeah. So I've spoken a lot about work and profession and passion there. I will say the question comes up a lot. How do you balance your profession and work with your personal life? I'll just start by saying you cannot be, at least in medicine, and I'm sure in other fields. I mean, I don't want to speak for other fields as much, but having talked to like 20, 30 people a day for the last 25 years, I mean, I know a lot about what other professions also do because my patients, do many things. If you're not healthy and whole and stable, it's very hard to then do your job, and especially as a physician, take care of other people. So the core principles that we talked about also in our new practice branding with SH Medical, looking at the wellness and care at home, the fundamental parts of that are exercise, sleep, and nutrition on sort of like maintaining the workings of the body. And then we do a lot of work around cognition because patients with hearing loss and sensory deficits have cognitive issues. And the number one variable there that we see is social interaction. If you're not choosing to interact because you can't see or hear, or you're not balanced, or you can't communicate properly, as soon as you start detaching, cognitive issues increase. So just from understanding the science, might as well just my own personal experimentation for health, you have to have these two aspects fully sort of put together. Like you have to exercise really every day. You have to sleep well as best you can, and you have to have pretty clean nutrition, and then use that to have social interaction and input. If you put that together, that balance, it's not about the minutes. It's not about a percentage. It's about feeling that stability that comes from that investment in yourself. And then that allows you then at work, at least from me, to be physically capable. I do surgery and I'm on my feet and I'm working in small areas. If I'm tight and if I don't feel healthy, I can't do that well. If I'm not energetic, I can't impact 30 people's lives every day if I'm low energy. And then if I don't feel mentally healthy or kind of calm, I can't assess and take their issues and then give them proper strategy. And some of that burden then from myself I could share with them, or their burden could kind of overwhelm me. That ability of social interaction with friends and family and humor and art, or whatever it is, music that you do outside for social, that allows that kind of reset, so that when you start the next day, you've not been used up. You've reset it. So I don't have a number for you or an idea of A and B. I'll just say that if you are not taking care of yourself, you will not be effective in your profession. Many people want to go into medicine. We have a lot of interactions with college students heading off to medical school, or even high school students who spend summer time in our office. The I think by far the number one thing to think about is, are you able to really put somebody else first when you think about a problem? It's really human nature to be self-protective, or to think about like your need or your strategy and then the next person's. um, Medicine and other professions of service and care really means when that door closes in the clinic room or that video visit starts, you put yourself out of the picture, and you really listen, and you really think what is going on with that other human and what can I do to help, and you bring your best capability forward. That skill, that ability to do that, is something that is, yes, for some people, empathy is inherent or inherent, but it can be developed. I've seen it developed in people who don't have it naturally, and they're excellent doctors. So that's number one. And if you just can't do that, then medicine is not the place, because you're going to be asked every day, multiple times, 20, 30, 40 times a day, to choose someone else's problem, not before yours, but you're not in that equation when that interaction is happening. Number two, it's a lot of stamina. Like it is something where you have to be willing to work a lot of hours for a long time before you gain the skills to be independent as a physician, as a therapist, as a surgeon, as a radiation oncologist, whatever it is that you end up doing in medicine, many fields obviously need a lot of rigor, but medicine requires physical stamina, mental processing, even when you're tired, and then emotional stability to be able to take yourself out of the equation when you're caring for people. So I would say the second skill, the second need is stamina. Do you have that? Can you keep going even when you're tired? And I would say the third aspect is an incredible intellectual curiosity, because you learn so many things in medical school. It's an incredible time where you are learning as if you're a kid again. You're learning 20 words a day, like this whole new language. But I have seen physicians who have not, had intellectual curiosity at the end of that. They kind of got burnt out by that process of medical school and residency. And within a few years, 5 years of practice, they become dated. Imagine having your original iPhone or your original Google phone and what the new version of the phone can do. Like, you have to continue to train. And unlike other fields, like, there's not like systems around, you have to go take these courses, but you can take a course and not really learn a lot. You have to have this deep sense of, I want to keep learning and getting better and improving. And that feeds back into concept one, which is, if you really have that for yourself, you'll want that for other people. Like, you want other people to get better because you're trying to get better. These are the three things that I have really, intentionally cultivated in myself and continue to grow. I feel like at 25 years of practice, I am getting there. It is a lifelong journey to continue to improve in empathy, to improve in stamina, and improve in curiosity. So those are the three things I would say that people should have if they are considering medicine. In changing our name from San Francisco Otolaryngology to SH Medical, part of that is bringing the care not just in the clinic or the video visit, but also to the home, understanding what's happening at home. And that also is for the education that we do with young people, high school students, college students, medical students, and residents. So if people are interested in medicine or have a story about medicine or have a question about medicine or the profession of, and not just medicine as physicians, but we have people that go into audiology, we have people that go into speech therapy, we have people that become PAs and NPs and radiology techs. Medicine is a lot of people doing a lot of things. We are very curious about what you're doing and what you're thinking about. If you have a question, if you have a story, if you want us to comment, if you want us to help you build connections, come to an internship, or you have a new technology idea you want to share, we're happy to help. Our facilitation of medicine is not just in the medical room, but in also the education aspect of it and in the research and technology development. So come to sh.health, our website, or come to our social media platforms like Facebook or Instagram or TikTok, YouTube, and leave a comment or send us a question. We'd love to share and collaborate. This is what medicine is, and this is how we take care of people.